Just like when we get an injury somewhere else, we go into what's called physiotherapy, which is basically aimed to improve the function of what is there. Similar to that, when we treat patients for mouth cancer, we want to improve the function of the remaining tissues and try to bring their life back to their normal quality that they used to enjoy when they started treatment. And that's what speech and swallowing therapy is for. When we operate on the mouth, some patients will lose some function. Today, with excellent reconstruction and very advanced surgical techniques, most people, we hope or try to achieve a normal life or normal return to normal life functions. People have many fears that they will never speak again, that they will never eat again. But those are situations that for the most part you never have to encounter when you undergo even very complicated treatments. And speech and swallowing therapy helps us. So it helps us maximize the benefit that we can give the patient once they complete their treatment. In some patients, the defects and the surgeries are very small and recovery happens naturally without any additional effort being put in. But certainly for more complex operations or patients who are a little older, whose recovery capacity is not as good as when you are young, they will need the help of speech and swallowing therapists to acquire best and maximum function. It is not true that if you don't take speech and swallowing therapy, you will not recover. I think that statement is incorrect or it is misleading. But you may not recover to the level you may have recovered with the therapy. Our bodies will naturally recover to anything. For example, I get hit, I don't go anywhere, I don't visit a doctor, I have an injury, my body will heal it. But if I reach the right physician, I get the right treatment, I may heal to a better degree. So that's how speech and swallowing therapy is important. It can make a mild difference, sometimes it can make a dramatic difference. Some patients need only a few sessions and that may last a few weeks. Some patients may need therapies for many months. It depends on the intensity of treatment, the problems that they are facing, and I think most importantly on the recuperative capacity of the person themselves. We all have different ability to recover from injuries, and that plays an important part as well. There are two components to speech and swallowing therapy. The first part is they're going to assess the patient to see where the problem is. For example, you have somebody who's not swallowing well after tongue surgery. So they will run certain assessments, clinical, sometimes they do x-rays, sometimes we examine the throat with scopes, and we'll reach a decision as to where do we think the problem is, which is preventing swallowing. We'll also assess what is the function of the normal remaining part, and based on that you devise a treatment plan. A lot of treatment revolves around specific exercises, but there are other therapies that also come into place like electrostimulation, etc. And then you will take the patient through that treatment plan. Initially there is an intensive phase. It's like a child learning to walk. The first few weeks or months are going to be the toughest for the child. There will be lots of falls. But once you start walking, it is very easy to start running after that. So same with these therapies. You have an initiation phase which is intense, frequent visits, frequent consultations. But then things get easier and you go into a maintenance phase. And today we can manage maintenance swallowing therapy even over video consults for many patients in the long run who need to be assessed once a month or once every couple of months for progress.